Hello and welcome. This is the YouTube series I'm doing on resilience of women in medicine. I have some wonderful women telling their stories of different obstacles they've overcome and extraordinary circumstances that have made them ultra resilient, particularly in midlife. And today I am welcoming Susan Wilson, MD. She is an emergency medicine doctor. She's a mom. She's a golfer like me, who had a setback in her medical career and her life that took her career in an entirely different direction. So now she is a coach for physicians and with a particular focus on second victim syndrome. Welcome, Susan.
Thanks, Bev. It's great to be here.
So you have a true story of resilience. Let's hear about what happened to you.
Well, so as you've mentioned, I've been practicing emergency medicine for 25 years, and I started developing significant visual issues back in 2017. So specifically a myopic retinopathy. And so this just progressed to the point where I just really couldn't see well enough to work anymore in the ER. I mean, my vision became very distorted and my depth perception was really off. So that really impacted my ability to do procedures. I got to the point where I just literally couldn't practice anymore. And so June of 2019, I ended up having to retire. Really bummed out. Being in my 50s, it was a really difficult thing to be going through. And realizing I really didn't have any control over it was also really hard. But I just thought about, I still really wanted to be involved in medicine. And so knowing that I couldn't work in the ED anymore, I kind of, after some soul searching, thought about coaching as a way that I could still give back to my healthcare colleagues. And then I also became very passionate about this whole concept of second victim syndrome. And actually, as my coaching has evolved, I've really found that is really the thing I'm most passionate about. And I've really taken it upon myself to really try to continue outreach and educating healthcare professionals about the syndrome and the help that's available to them.
And were you focusing mostly on burnout or dissatisfaction?
Yeah, I mean, my initial thought and what I still am doing is focusing really on the whole issue of job satisfaction. And then, that obviously is along the spectrum of actual burnout, because I just felt like in my career, I felt like I had techniques that I used all along to prevent myself from becoming burnt out. And so I thought, well, maybe I could help others to discover those things in themselves. And interestingly, so the whole second victim syndrome topic actually became important to me back in 2017 when I actually heard a lecture about it. And this was when I was still practicing and heard a lecture about this syndrome and realized I have been living this for my entire career. And so that actually spurred me on then to learn as much as I could about the syndrome, and the fact that peer support was really kind of the treatment, if you will, for that. And then knowing that as a coach, you really have all of the skills to provide that kind of support. I mean, it just seemed like a natural fit for me.
Do you think certain physicians are more likely to fall victim to the second victim syndrome?
Well, I really think that anyone that has any kind of significant interaction with patients will have something like this happen to them. I mean, there are so many different scenarios where this kind of syndrome occurs. I mean, it's not just a patient dying, but there's all sorts of other things like a delay in diagnosis, an error, complication of a procedure. I mean, there's a lot of scenarios where I think physicians really do suffer from this. And so, I mean, I would argue that even, like a pathologist, if they misread a biopsy and they report something out as being benign and it's really malignant. So yeah, I think it affects really everyone across the board in medicine.
Well, and when you think about how those kinds of either errors, mistakes, or judgment calls have been criticized in our quality assurance, quote unquote, committees, they really don't address how it affects the physician. And you're right. I think those physicians really need support.
Oh, absolutely. And, I think physicians have notoriously been stoic and they have not wanted to seek support and they haven't wanted to share how they're feeling. But we're really learning that this is very widespread. And, the whole concept that, well, physicians, we're also human beings. And so as a human being, we inevitably are going to make a mistake from time to time or have an error in judgment or have something not go the way we expected it to. And again, that also then speaks to, this whole idea of perfectionism, and physicians feel that they should be perfect.
Yeah, I agree. I think there's a lot of shame too in, just how people feel about the fact that they didn't get it exactly right. And they may even not come forward because of that shame and ask for help. So how are you presenting yourself as being available for that kind of coaching?
Well, it's kind of I think a multi-pronged approach. I mean, I think really the first piece is education. And it's very interesting to me how many people in healthcare don't even know that they don't know the term. And then when you explain it to them, they're like, oh, yeah, okay. I mean, because we've all experienced it, but nobody knows that there is actually an identified syndrome out there. So I think the education piece is super important. And the fact that there is this recognized kind of support that's available. So getting the word out, getting that message out is really important. I think also not only to the individual healthcare professionals, but also to healthcare organizations. I have been very fortunate that I am associated with an EAP, an employee assistance program, and who offers coaching. And, honestly, a lot of EAPs don't even offer peer coaching. So I feel very fortunate that I was able to find an organization like this. And so through them, I'm also trying to continue outreach on the topic. And they've been really great about, really trying to also advance that message.
Did you yourself have a particular experience in your emergency medicine career that really hit home for you with this?
You know what? I have had so many. Well, maybe I shouldn't say that because then people are going to think I'm a bad doctor.
But I'm sure they're not going to think that.
Oh my gosh. Well, so I'm emergency medicine. My husband also is an emergency physician. And so I, through my entire career, have been very lucky because he's basically been my peer support. So, I would have something even really small, like sending somebody home that, came in for something unrelated and realizing after I discharged them, their blood pressure was through the roof. So even like something really little like that would really impact me. But I've definitely had, the very last case I had in my career of a critically ill patient, I was actually working, luckily, with my husband in the emergency department. I had a morbidly obese patient come in that was extremely ill, needed a central line, needed to be intubated. So the intubation was very difficult, but it was accomplished. And then I had to put a central line in. Well, I caused a pneumothorax. And in my entire career, I have never had a pneumothorax complication from a central line. And so that, I just remember that feeling physically sick. I mean, I just, I could tell like my heart was racing. I had a dry mouth. I felt nauseated. I felt, I kind of couldn't concentrate. My brain was kind of scattered. And like I said, luckily my husband was working with me in the ER at the same time. And so I was able to just grab him and say, you need to come in here, please help me. And he did. I mean, he helped me get through everything. But yes, I remember that feeling. And so I've had episodes like that intermittently throughout my career, and I really have found that having somebody to kind of talk through it and helping you to kind of maybe get a different perspective on what transpired is so helpful. I mean, it's been so great. And the fact that I had these kind of cases throughout my career, but they didn't completely defeat me. And it wasn't like I just threw my hands up and said, I'm leaving medicine. I can't do this anymore.
I think it's quite incredible that we remember our complications and our worst cases more
Hmm.
so than we do our positive ones. And
Hmm.
it would be so helpful to just remember that, yeah, you are a good doctor
Right,
and
right.
you do your best. So what's the status of your vision at this point?
Well, unfortunately, my vision is not very good. I did have surgery on both of my eyes. So I had a vitrectomy, which is kind of a big deal, and then a what's called an epiretinal membrane peel. So if you can imagine, somebody going into the back of your eye, taking the vitreous out, and then peeling off the very top layer of the retina, and then having to have a gas bubble inserted to help the retina heal back in place. That was done twice.
Mm,
And actually, my left eye, actually, it worked pretty well. And actually, now that's the eye that I'm really kind of relying on for, if I really need to see something really well, I literally closing my right eye. But then on the right eye, I just have this persistent kind of distortion of my vision. So that has made things day to day kind of difficult. I'm now using an eye patch when I play golf, and it actually really helps. If nothing else, I'm intimidating to the people I'm playing golf with.
I think that would be incredibly intimidating.
Yeah.
I mean, is this going to be progressive to the point of blindness?
Well, having the surgery, I think basically has stabilized everything. And so I think for the foreseeable future, things are going to be stable. I mean, I can see I'm not blind, but it's just like I said, everything's distorted. And, I think for me, it was very difficult, just kind of going through this because it's this gradual progression. It's not like it's suddenly I woke up one day and it wasn't like I had a stroke and I suddenly couldn't move my right side. It's just I definitely went through, all the stages of grieving, if you will. I mean, first I was in denial, like, oh no, 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 this cannot be happening. This absolutely can't be happening. And then I was angry. I just was like, why? Why would this happen to me? I was just really upset and thinking about the implications for everything in my life. I mean, work, but my just independence, driving, and just doing stuff around the house and sports. Like I used to play a lot of tennis. I don't play tennis anymore because my depth perception is so distorted. And then I was really depressed. Um, just I had several nights where I would just cry myself to sleep thinking about, oh, I can't believe this is happening. I'm too young for this. But now I've kind of gotten through all of that and I've just accepted it. And it is what it is. And, I mean, it probably sounds a little corny, but, I'm just glad that it's on me and it's not on my children. And, I feel like, um, I can get through it, and it's just sort of it's my new normal, so to speak.
Yeah. And just all the changes that you must likely have to deal with now with reading. I mean, even being on the computer, I'm sure is
Mhm.
challenging sometimes. So you're doing the coaching full time, or what does that entail for you on a day-to-day
Yeah,
basis?
I've really kind of devoted myself to coaching, and I kind of decided in my mind that I was going to be available 12 hours a day, 7 days a week, especially for the peer support. As we all know, these kinds of things happen at any hour of the day or night. It's not always a 9 to 5 thing. So, for example, I had a case, a gal had a bad case on a Friday night of Labor Day weekend, and she really wanted to talk to someone Saturday. And so I talked to her Saturday, and then I think we talked again on Monday of Labor Day weekend. And so I think I do have the luxury of, not working clinically. So I'm really available, pretty much all the time. And I feel like that's helpful for my clients because, they know we can get together, whenever. And if they need help, in a couple of days, we can certainly do that. And so, yeah, it's a full-time thing, but I'm really enjoying it.
So if people are interested in reaching out to you either for coaching or for hearing more about what you're doing with second victim syndrome, how can they find you?
So my personal email is susanwilsonmd@gmail.com. And I do have a website, and that has all of the information about my coaching services. And actually, I did just put in a separate tab about second victim syndrome just to give people a little bit more education on that. And my website is sjwprofessionalcoaching.com.
Wonderful. Thank you so much for sharing your story with us today. Hopefully it will be inspiring to some of our women physicians who will be watching.
Well, thanks so much, Bev. I'm really glad to be able to come on and talk. And I think the only parting comment I would like to make is anyone that finds themselves with a challenge like this, I think it's really important to remember that even though you may have some kind of a physical handicap, you still have so much else to offer. And to remember and just to embrace all of the things you can do, I think is really important.
Absolutely. Good parting words. Thank you very much.
Thanks, Bev.